and you can start. Perfect.
Did you want me to start then?
Oh, I can do a very
short
introduction first. So good evening, our young students, public health professions, researchers, young scholars. Welcome everyone to coming for our CNIW Supernova Summer Camp Series public seminars. And today's seminar, we are going to talk about a very interesting topic. Is there a role for informed consent in public health research and policy? I think it is a very timely question that seeks to explore the delicate balance between individual rights and collective well-being. And we're so honored to have a really well-known scholar, Professor Pullman, with vast experience and rich full perspective in this field. And hopefully, I think his presentation could spark more discussions that resonate not just in academic circles, but also maybe in practice or policies that can touch all our lives. And we do value the spirit of open dialogue and invite everyone, if you like, to participate actively in our Q&A sessions. So during Professor's presentation, please leave your questions. Ariana will be our moderator, and she will start to raise some questions that we previously collected from our summer camp students, but also we promise everyone have a chance to raise up your hand and ask your own questions. Okay, so before we start, I would like to extend our sincere gratitude to Professor Pullman for your great support and effort which have made tonight's possible. And Professor Pullman is a bioethics scholar in the Center of the Bioethics Faculty of Medicine at Memorial Universities. And he also has a clinic ethic appointment with the Provincial Health Ethic Networks for Newfoundland and Labrador, where he supports ethic consultations on a wide range of clinic ethics issues. So I think he will have a lot to share with us. Maybe for some of our students, it is a very, very new topic that you have never have access or exposed to. But I think it will be a really resourceful, inspired, and very informed night. So without further ado, I would like to pass the microphone to Professor Pullman. And now it is your time. Welcome. Thank you.
Well, thank you very much. And I'm very pleased to join you this evening. And I'm sure there's lots of other things you'd like to be doing on a Monday evening in the summer. But you've come to listen to me talk about public health ethics and some of the challenges that we have in developing policy, doing research in the public health field. So you'll have to forgive me if because I don't know how much background any of the students have in general about the nature of public health or about the nature of ethics. So I may cover some ground that are all very familiar with, but hopefully we'll come across some points that are new to you, and I'll be happy to take your questions later. I did have a couple of interactive things that I was going to do, but in the interest of time, I think I will just sort of raise those questions, and then if there's points that anybody would like to discuss afterwards in the Q&A time, we will do that. So I'm going to share my screen now, I hope. Let's see here. So can everybody see that?
Yes, we are.
Okay. So the title of my talk is there a place for informed consent in public health research and policy? And this is a general outline of what we're going to talk about just the enterprise of public health, goals, interventions, and actors that are involved. The central tension in public health ethics, and it's already been mentioned, and but we'll come back and spend a little time about how we sort out that tension in public health ethics between the general good for all of society versus the individual rights of citizens to make their own choices and to organize their life in their own way. And that will bring us to the question of informed consent and what role does it serve in public health. So that's kind of where we're going to go. So this is my first interactive question. I want you to think about this. So the statement is my body, my choice. And so no one should be forced to do anything against their will. Do you agree or disagree with that? That's a very fundamental kind of question. In a free and democratic society, we generally think that we should have the freedom of choice to do with our bodies as we will, that no one should be able to force us to do that. But that raises another question when it comes to the kinds of activities we decide to participate in. And so the other agree, disagree statement that I might ask you is that if someone chooses to participate in a high-risk activity, should they be required to pay higher health premiums? So that if you tend to engage in very high-risk sports where there's a possibility of injury, we often hear about hikers that go out into the backwoods and they get lost, and then it costs a great deal of money to go out and find them and so forth. So from a public perspective, we might ask, should people who decide to choose those kinds of high risk activities be required to pay higher health premiums? Should they be taxed at a higher rate in terms of their health care and so forth? So that's another kind of question that might be raised in this general area of public health, and how do we organize it and so forth. And so so again, just probably some review for you here. What is public health? Well, public health is a set of
Professor, sorry, I have to cut in. It seemed to me that your slide doesn't move. It stays on the title page.
Oh, is that right?
Yeah.
Oh, let me see here. This has happened to me before. So.
Okay, yeah, now it works. Yeah.
Okay, I'm going to have to keep it. I won't be able to put it in presentation form. Then I'll have to do it this way, because this has happened before when I was given a talk just about a month ago, and I don't know if it has to do with Zoom or has to do with my computer. But thanks for interrupting. And so that was my agree disagree statements. So my body, my choice. So think about those, and we can come back and talk about these questions at the end of the during our Q&A period at the end of the time that we have together here. So what is public health? Well, public health is a set of institutions and initiatives that are focused primarily on the health of the entire population rather than the health of individuals. So when we take a public health perspective, we're talking about the overall good of society. What are the kinds of policies and procedures that we should put in place to ensure that we're protecting everyone, that we are doing things that are going to be for everyone's well-being, even though in some cases it may, some individuals may feel that they are being forced to do things against their will, and as far as consent is concerned, that they were never asked for their consent, nevertheless they have to do this kind of activity. So so that's generally what public health is all about. And who are the actors that are involved in it? Well, government has a very central role in public health, because it's usually a very much a top-down kind of activity that the government sets policy. Of course, the public is involved. We'll have public health officers. Physicians are often required to give to pass information to the public health agency about infectious diseases and so forth. We have public health nurses who go out into the community to initiate various kinds of policies. And of course, there are healthcare system decision makers who are involved in developing policy around public health. So these are all the kinds of individuals that would, in any society that has a public health program, these are the kinds of actors that are involved. And of course, we're all involved because we are all part of society, and we're all going to be affected, or part of the public that is going to be affected by public health policies. So there are many, many public health policies that are going on all the time, and many of them we're largely invisible to us. We just take them for granted. The fact that we can turn on the tap and have clean water, that we can we know that we can drink from the tap and not have to worry about contamination in terms of our water supply. Well, that's because we've got public health policies and processes in place. In some communities, the drinking water has fluoridation added in order to protect teeth. That's all a public health policy. We have food safety standards that are set by the Public Health Agency. They do inspections of restaurants and ensure that the food that we buy in the supermarket is going to be free from contamination. It's not going to be rotten and so forth. These are all public health policies and procedures that are put in place to protect all of us, and many of them we simply aren't even aware of. And of course, there's emergency preparedness and responses as well. And I had a colleague at one time who was worked in the area of food safety, and I remember him saying to me at one time, he said, every time anyone eats at a fast food restaurant, he said, every time you eat at a fast food restaurant, you're putting your life in the hands of people making minimum wage. So that's something to kind of a sobering thought, that if people who are preparing our food in the restaurants that we go to, if they're not maintaining the kind of standards that are required by the public health policies and processes that are in place, that would put all of us at risk. But it was a sobering thought when he said that many years ago, when he said that to me, and something for you to think about as well. But so these are the kinds of public health policies and processes that are in place that we, as I said, largely take for granted. They ensure that we have a safe community, that we can go to the supermarket, go to restaurants, drink the water, and so forth. All of those are policies that public health agencies are responsible for ensuring that for the good of society. But then there are others that are public health initiatives that are a bit more visible, and often for many people, they are viewed as matters of personal choice. So drug and alcohol control, for example, should people be restricted in terms of what they can do as far as tobacco consumption, for example? We've over the years, we've got stricter and stricter policies about tobacco. We now have labeling on all cigarette packages and so forth. Those are all public health initiatives. And as far as road safety is concerned, now in Canada, when I was a child, we didn't have mandatory seatbelt legislation, but now if you're going to drive a vehicle or be a passenger in a vehicle in Canada, you have to wear a seatbelt, and that's mandatory. It's enforced by law. If you're going to drive a motorcycle, in any province in Canada, you have to be wearing a motorcycle helmet. But many people think, well, those are really personal choice kinds of matters. If I don't want to wear a seatbelt, why should I have to? If I find it uncomfortable to have a seatbelt on, shouldn't that be my own choice? If I enjoy riding a motorcycle without a helmet on, it wouldn't affect me, but some people would like to feel the breeze blowing through their hair. I unfortunately don't have that opportunity anymore. But should we be forced to wear motorcycle helmets when we drive? Well, those are public health initiatives. And again, there's that kind of tension there between, well, should this be a matter of individual choice, or should it be mandated from the top? Should it be top down through policies and enforcement mechanisms, or should really we just leave it up to the individuals to make their own decisions? So that is all of that is going on in the public health sphere. And those are the kinds of tensions that we're dealing with all the time from an ethical and also from a legal perspective. So again, this is public health ethics we're talking about, and this is the central tension. So again, the goal of public health is to maintain and improve the health of the population. And again, the key difference between public health ethics and other areas healthcare ethics is that in the public health sphere, we're looking at the public good. We're setting policies and procedures to ensure the good of everyone. Whereas in clinical ethics, and as was mentioned at the beginning of the talk, I do a great deal of work in the clinical ethics realm. Oftentimes we're emphasizing the individual rights of individual patients, that the patient shouldn't be forced to have a treatment that he or she doesn't want. We emphasize that the patient should be able, that if we're going to do something to an individual in the healthcare sector, we have to get their informed consent to do that. So consent plays a very, very major role in the clinical ethics realm, whereas in the public health ethics area, informed consent has a much lesser role to play, at least in the overt kind of way that you go and ask people specifically whether they agree to a particular policy and so forth. So again, we could give the example of vaccines. We've all just come through the pandemic. We've all, most of us have had a vaccination, have had an opportunity to get a vaccination and so forth. And here this sort of illustrates the kind of tension. So in clinical ethics, where there's that individual freedom, rights of autonomous choice, and various other kinds of freedoms, we support the ability of people to refuse offers of healthcare. And so oftentimes vaccinations are a matter of personal choice. We know, for example, and we'll look on the public health ethics side, that it is the good for the good for the health of the community if most people are vaccinated against infectious disease. I mean, from a public health perspective, even for the regular seasonal flu vaccines that usually come out around in the early fall here in Canada, it would be good for the population if everyone received a flu vaccine in the fall. Because we know in a public health sense that if we get a certain percentage of the population is vaccinated, then we'll have herd immunity and it will stop the infection from happening. And we could justify forcing people to have a vaccine in terms of the common good. But yet, despite the relatively low participation rates in seasonal vaccination programs, governments generally hesitate to force compliance. We don't force people to have vaccinations for the seasonal flu. Now, in a pandemic situation, as the risk to the community grows higher, we may think about a more direct kind of policy, and again, those are the kinds of tensions again. How do we ensure that individuals are going to not be restricted more than is necessary in order to engage in a public health policy? and when is it appropriate to ignore what the will of an individual person is and say, sorry, you may not want us to do this, but we're going to do that. And there are, aside from vaccination policies, there are certain kinds of public health policies that really just set aside individual rights. And we'll come to some of those in a moment. But I just want to, again, to think about, well, what is the ethical and legal rationale for a public health ethic? And of course, in Canada, we have the Canadian Charter of Rights and Freedoms. It's if you are a Canadian citizen or a resident in Canada, you have you enjoy all of the rights that are listed under the Canadian Charter of Rights and Freedoms. And here are some of the rights that are listed there. As this slide suggests, all the rights and freedoms that we have in Canada fall into seven different categories. There are fundamental freedoms, democratic rights, mobility rights, legal rights, equality rights. But all of these rights are really individual rights. These are the Charter of Rights and Freedoms in Canada guarantees that these are rights for each one of us as individual citizens. But and so we are told basically that we have these rights in a democratic society. We can live where we want to do. We've got certain kind of legal protections afforded to each one of us. We're considered to all be equal before the law, and so forth. All of these rights are enjoyed by all of us as individual citizens. However, there's one statement in the Charter of Rights and Freedoms, and it's the very first one. The Charter of Rights and Freedoms begins with this statement. It says, the Canadian Charter of Rights and Freedoms guarantees the rights and freedoms set out in it, all of those ones that I just listed to, subject only to such reasonable limits as can be demonstrably justified in a free and democratic society. And so this first statement in the Canadian Charter of Rights and Freedoms is really what gives us the legal and then the ethical basis for a public health ethic, because we say this first charter, the first statement in the Charter of Rights and Freedoms says that we can set aside those individual rights and freedoms if we can show that it's reasonable for us to limit those rights in order to justify the kind of limitations that we're going to have. And so that's what public health ethics really is in a certain way. It's a limitation on individual freedom with the goal of maximizing the benefit for everyone. So this slide kind of shows that kind of tension there. So at the government level, we are concerned about the common public good. From an ethics perspective, we use the term consequentialist, which means we look at the consequences. We say the end justifies the means. Yes, a public health policy can be justified because the end that it's going to do is ensure that the good of all of society is protected. And so, but then as we get down to the individual level, we focus more on individual rights, and here we in the ethics language we use, we call it deontology, which focuses on the rights and privileges of individuals. So we have that clinical ethics focuses much more on this individual level, whereas again, from a public health perspective, we're focusing much more at this level, and that's what the whole tension is. And again, when we're doing public health, the goal is to promote the health of the community. Individual rights are not the priority, but that doesn't mean that we ignore individual rights either. It simply means that we have to weigh very carefully what kinds of individual rights are going to be limited? When is it appropriate to limit them? And what is the most appropriate means to limit the rights of individuals? So we have a number of different kinds of public health interventions here, and the least sort of invasive way of doing public health and getting people to agree to limit some of their liberties is to educate them. So we can do public health education. We can make certain kinds of public health resources available. We can use persuasion, which is one step up from facilitation, where we may have mass media campaigns that the difference between health education and persuasion can often be kind of nebulous. The government often puts out various kinds of public health educational kinds of things about proper eating, exercising, and avoiding certain kinds of other patterns of perhaps alcohol and tobacco consumption. We do that. We try to facilitate and persuade people to do that. But in some cases, if it's believed, it's thought that something is, we really have to try to push harder. Government may start to manipulate things through tax and insurance incentives or disincentives. For example, if you happen to be a cigarette smoker, the taxes on cigarettes are quite high, and that's a way that government tries to manipulate people who smoke to stop smoking because it's going to cost you so much. And one of the other rationale there is that since cigarette smokers tend to have more health problems, we can use the tax money that we get from them to offset some of that expense as well. But then in really important when there's really extreme concerns about the health of the public, we may actually go all the way to coercion, where we have legal prohibitions or legal requirements. And that's effectively what we do, for example, with, well, road safety. We prohibit people from driving their vehicles at any speed they wish. We put speed limits on the highways. We require people to wear seatbelts, and it's against the law to drive when you're under the influence of alcohol or drugs. Those are all public health kinds of initiatives, and different ways in which government tries to promote the common good, again, in the least invasive kinds of way, unless it's believed that only if we're going to be coercive will we get people to behave the way we need them to behave in order to maximize the benefit for everyone. Of course, one major difference, for example, when you think about Canada versus the United States, in the United States, any attempt to have gun control is pushed back very forcefully by the public, and it's such a big political issue that they have very little gun control in the United States. So we hear constantly about the number of deaths by people using firearms and so forth. Whereas in Canada, we have more prohibitions, more restrictions on people's ability to get firearms and to use them. And again, there's a public health rationale for that. But different societies will manage their different public health policies in different ways, depending on a whole bunch of different kinds of factors. So just in general, as far as public health interventions are concerned, less coercive interventions, such as an educational program about sexually transmitted infections, for example, would require less stringent ethical justification. If you're just going to do an education program, then you don't have to have a really strong ethical justification for that. It's just you're not being all that invasive. But if you're going to do a more coercive intervention, for example, if you have a vaccine mandate and say that people won't be allowed to leave their homes, they won't be allowed to go to work, they won't be allowed to go to school unless they can prove that they've had a vaccine, well, that's a very coercive intervention, and it would require a much more stringent kind of ethical justification for that kind of intervention. So as far as public health policy is concerned, we've got a number of different ways in which we can try to promote or introduce various kinds of public health policies, but each time we're going to override individual liberty. Each time we're going to tell people that you're going to do this and we're not going to ask for your consent, you're just going to have to do it. Then we have to have some ways of justifying that particular policy, that particular intervention from an ethics perspective. And I'm going to talk about each one of these just briefly. The effectiveness, proportionality, necessity, least infringement, and public justification. So as far as effectiveness is concerned, in order to justifiably infringe an important value like individual liberty, about making people do something against their will, about not asking people for their informed consent, there must be a good chance that the intervention is going to be effective. If we're going to have a vaccine mandate, for example, and we're going to force people to have vaccines, we have to be pretty sure that that's going to be effective, that that's actually going to achieve what we want to do. Because if we introduce a policy that's very draconian and forces people to do something that they don't want to do, but then at the end of the day, that policy isn't effective at all anyway, it doesn't actually achieve what was intended to do, then we've failed ethically to justify why we would have that infringement in the first place. Sorry here. Proportionality means that the benefits from introducing some kind of an infringement on the freedom of individuals are going to outweigh the costs of taking away somebody's autonomy. So if we tell parents, for example, that you have to get your children vaccinated, and the parent says, "Well, these are my children, I get to choose," and we say, "Well, sorry, we are going to, if you want your children to go to school, the public school, then they're going to have to be vaccinated." We're going to have to ensure that however we introduce that is proportional to the actual risk that there is to society. So on balance, the results of whatever policy we're going to do must be more positive than negative. The necessity requirement simply says that we have to be sure that there's not another strategy to get to our goal that is less morally troubling. Because we might have an effective and proportional, probably, a policy, but it's unjustified if there's another way. If we could get people through education to do something that they would choose to do on their own, which would effectively say that they are giving their consent because they're going to do it, well, then we should be doing that rather than forcing people to do something that they otherwise might not want to do. So we can only justify a public health policy and an infringement on individual freedom if it's the only thing that we've got available. We've tried everything else and it just is, we're not getting the result that we want. Then we would be able to justify taking a more strict kind of coercive measure from a public health perspective. Similar to necessity, least infringement says that if there are other ways of reaching your goal that infringe less upon general moral considerations. So necessity and least infringement are very similar in that respect. And finally, a public justification. Interventions that have infringed general moral considerations need to be explained and justified to the relevant parties. Can it be justified and defended publicly? And can it be administered transparently? Public health policies have to be publicly discussed. They have to be available for the public to understand, and we have to be transparent about what we're doing. It would be unethical for the government to decide that they were going to introduce some kind of a chemical into the food supply because they thought it was going to make everybody smarter, even though there was a risk that people could get cancer. That's just making something up out of on the fly here. But if the government can't come to the public and say, this is why we're doing this, this is the justification for this public health policy, and if it can't be administered transparently, then the public, it cannot be justified from a public health perspective. So that finally brings me to the issue that we were started off with, the public health policy and informed consent. And so informed consent in the clinical side of things, if we ask patients, do you consent to this blood test? And say, no, I do not consent, then we don't do the blood test. That's the nature of informed consent in the clinical aspect. Informed consent plays a critical role in virtually every area of clinical ethics because it's individuals, it's the individual's health that is being looked at from an individual perspective. Whereas in the public health side of things, if we had a vaccine mandate and we say, do you consent to this vaccine? And the person says, I don't want the vaccine. Well, they could be coerced to it. Their informed consent, depending on the public health policy, may be irrelevant. They just, there's no consent required because it's deemed justifiable from a public health perspective to force people to do things that they might not otherwise want to do on their own. So what are some of the elements of informed consent? Well, it has to be voluntary. And again, here we use that even within that, what we looked at in earlier on in terms of the public health trajectory. I'll just go back to that slide for a minute, if I can find it again. Here, we've got persuasion, manipulation, coercion. Well, we have the same kind of thing in the informed consent area. We want it to be voluntary, and even with public health policies, we want to be as least coercive as necessary. So that's why we try to do education. That's why we do public health campaigns and so forth. And it's only in the most extreme kinds of situations where we're going to we would go to coercion. And then authorization. In a democracy, public health authorization generally occurs at the macro level through established political processes. In the clinical area, authorization is often that you sign an informed consent to say if you're going into the hospital, you're going for a procedure. If you're just going to your doctor's office to have a checkup, your consent is presumed. Your authorization is presumed by the fact that you showed up to your doctor's office and asked him or her to give you a physical examination. But if you're told to go to a hospital because you need surgery, you need an invasive procedure, then we're going to get you to authorize that by signing a consent form. Now, very seldom in the public health sphere do we get that kind of authorization. And as this point says here, in a democracy, public health authorization generally occurs at the macro level through established political processes. If you don't like the government's policies, vote them out. Occasionally, public protests may be mounted in an attempt to have a policy suspended or changed. And if you recall, just a couple of years ago, during the pandemic, there were the truck convoy that went to Ottawa, ostensibly to protest against the public health policies that the government was putting in place around vaccination, around social distancing, and so forth. People were protesting against that. So that's a legitimate form of in a democracy, oftentimes. But if it becomes too much of a burden on society, then other kinds of interventions may be necessary on the part. And we saw eventually the government took some very strong approach to stop that kind of a campaign. But that is one way of letting your will be known in a democracy. But then, as far as other kinds of public health policies, many people will simply just ignore them. And we never did have a vaccine mandate in Canada. It was never absolutely required that you get a vaccination. And so there was a certain number of the population, even though there was lots of education, even though there was certain kinds of persuasion and manipulation attempted on the part of government to get people to get the vaccine, there were some people that simply ignored it and never did get vaccinated. So here's another question that we might think about, and we might discuss this here in a couple. I'm just about finished here, and we'll give you a chance to ask some questions. But in Canada, as you all know, we've got a publicly funded healthcare system. Does that give the government a greater right or authority to impose certain public health measures than would be the case in a jurisdiction without public funding? Does the fact that we all get basic health care provided to us through the government, does that give the government greater authority to impose certain kinds of restrictions on us? If we had to all pay for our own health care out of our own pocket, would there be less justification for the government, for example, to say that we had to wear seatbelts, that we whatever other kinds of public health measures are put in place, and so forth? And that's another thing to think about in terms of public health. So what about public health research and informed consent? Well, effective public health policy requires ongoing research, that's for sure. We wouldn't be able to justify various kinds of public health interventions if we didn't do a great deal of research. And people like Dr. Wong, whom you've all know, he's a public health researcher. He does a great deal of research in this area, and public health researchers are looking at data all the time. But what role does informed consent have here? So oftentimes public health relies on administrative data. That refers to data that's collected and maintained for administrative purposes within the healthcare system. So we've got billing schedules, reimbursement patterns. We want to know you know, where most of the money is going, what are the kinds of conditions that people are getting admitted to hospital for, what kind of procedures are being performed. That's all kind of administrative data. It's not personal health information, because we take aggregate numbers. That is, we take numbers about you know, how many kinds of surgeries were done, how many people from this age group were admitted to hospital, and so forth. That's there's no need for consent in those kind of situations, because we're just taking aggregate data when we do that. Now, generally just like in the clinical realm, generally all human subjects research must be reviewed and approved by a research ethics board. And if you're involved in a clinical trial that's been approved by a research ethics board, you're going to get your informed consent to participate in that trial. But oftentimes in the public health realm, as I've already pointed out with administrative data, there's no one to ask for consent, because we're just taking aggregate numbers. We're looking at huge data sets where nothing's identifiable. So in public health surveillance, for example, that's an aim, is to monitor and track population level health trends, identify potential outbreaks or diseases, and guide public health interventions or policies. And now it may involve the collection and analysis of personal health information, such as certain infectious diseases. If a physician examines you as an individual and you have a certain infectious disease that is deemed to be a public health risk, that physician is required by law oftentimes to report that information to the public health agency, so that public health officials can track the nature of that infectious disease. And it may be necessary even to do some contact tracing. That is, if you were infected, that we have to report that to a public health agency. And this happened even in the early days of COVID, that if somebody was infected, it got reported, and we did contact tracing, which meant that we tried to find out everyone that was in contact with that individual person. But again, there was no informed consent asked for in doing that kind of research and collecting that kind of information, because it was the overall good of society was considered to trump the individual's right to control that personal health information. So informed consent plays a very, very minor role in that traditional sense in the public health sphere. Now, there are different levels of identifiability of personal health information. If somebody's collecting your personal health information, it's generally going to require that you get consent at the individual level. But much of the information that is collected through these kinds of public health initiatives would be de-identified health information. That is, there's an agency that takes personal health information, de-identifies it, aggregates the data, and passes it on to the researchers. So again, there's no need for contacting individual persons, because that information can never be linked back to the individual. And then there's anonymized health information, where no identifier, it's no longer possible to identify who the individuals were that from which the data came in the first place. So again, no need for informed consent. So this last slide here just shows more or less, and again, because I'm not in presentation mode, I've got a whole bunch of stuff on there that you can't see, but on this axis, on this side, we're talking about the public safety risk. If the risk is high or low, that's what that axis is. And the x-axis on the bottom talks about whether the personal health information is identifiable or not. And so if the risk to the public is high, and even though the information be identifiable, consent may not be required. However, if the risk of the and that's largely where we are with public health reporting around infectious diseases and so forth. There's because there's a high risk to the public, even though it may be identifiable, we don't require consent. We actually collect that data, that information without consent. However, if there's a if there's very sensitive information that might result in stigmatization of individuals if they were identified as being part of a group, if it would be impractical to or if it wouldn't be difficult to contact individuals, even though it's a public health kind of thing, then we may ask for consent. And again, a research ethics board, when they're looking at various kinds of public health research initiatives, they will ask those questions. Well, what is the risk to the public? What is the risk to the individual? Can we collect this information without stigmatizing individuals? Could we go, is it such a small number of people that are being involved in this that we could actually, it's practical that we should contact them? Then the Research Ethics Board may say that, yes, that even though it's a public health research initiative, there's a possibility that individuals will be identified because you're going into a isolated community and so forth. So you're going to have to get the consent of individuals. But again, as you can see from this slide, very seldom in the public health area is consent going to be required. If it's anonymized data and low risk, or anonymized data and high risk, still no need for consent. So that's I covered a lot of ground here very quickly. We're already past 9:30. So just summing up, public health research and policy occurs at the macro level. The primary ethical justification is the overall good of the community, and individual rights can be set aside, including the right to informed consent if it is deemed necessary to ensure the overall health and safety of the community. So that's, in a nutshell, the role of informed consent in public health policy and research. So I've covered a lot of ground, and I know that we're past the hour now, so I'm going to stop sharing. I think I stopped sharing. Are you still there?
Yes, we are still here. It is a wonderful, wonderful sharing. I personally learned a lot. I don't know about the audience, but I personally learned a lot, and I'm taking my notes. So right now, we'll invite you to Ariana, who is the TA of our summer camp and also a very talented young student at University of Toronto. So she will be the moderator of the Q&A session. And if anyone you have questions, please leave the question in the in the chat box. And I have already seen several of the questions there. So Ariana, how about you started the Q&A session with our questions collected from our own students? And
yeah, sure.
okay, thank you.
Yeah. I'll start with the questions in the chat. So regarding the drug use public policy, do you think we should change our approach to legalize the illegal use of drugs? Is decriminalization in Canada effective?
Well, that's a big question.
Mhm.
And of course, you know, we've decriminalized access to some of what are considered softer drugs like marijuana and so forth. And there are people who say that that we should be decriminalizing even harder drugs as well, because the fact that they're criminalized, there's the it just means that there's a criminal element being involved in it. But those are very, very difficult things to sort through, and I wouldn't pretend to know the answer to that. But that's a very good question from a public health perspective, because you know, 100 years ago, there was prohibition throughout most of North America, meaning that it was illegal to sell or consume alcohol. And because there was such a huge underground market for it, and it became so dangerous that governments finally came around and said, well, we want to regulate this. We want to have some kind of control. And so those are the kinds of questions that are being asked now as well, because you know, we have loosened up regulation or kind of the criminal aspect of possession of soft drugs like marijuana and so forth. And there's you know, we've, even with treating some of the hardcore drugs, like you know, Vancouver's been a real leader in introducing harm reduction policies that are really just trying to provide people with safe needles and so forth, and not pulling them off the street and throwing them in jail because they happen to be using drugs, you know. So again, those are considerations that have to be taken into account for sure. And some of the reasons, as the question suggested, you know, asked, are they effective? Well, those are the reasons that we start thinking about, well, if the policy that we have in place now is not being effective, we go back to those 5 points, then maybe we have to think about doing something different. And so that's a very good question from a public health perspective for sure.
Okay, thank you so much. Another question in the chat is, you mentioned that taxes from cigarettes can help offset the cost of increased healthcare costs for the comorbidities caused by smoking. Other than in my opinion, poorly enforced temporary mandate for accessing public spaces, there has not been a significant restriction or offsets for refusing the vaccine. Do you know of any ideas that were floated around? Are there any forms of coercion that would be worth trying should a similar situation arise in the future?
Well, again, that's you know, we now have the benefit of 2020 hindsight, you know, and you know, we managed to get through the pandemic, you know, without having to go to that level. Although, you know, Canada, as compared to other, you know, rich countries, there are other countries that did better than we did in terms of, you know, the number of deaths there were, that they managed to introduce policies that were, for whatever reason, more effective. And again, there's that's a whole area of public health research that has to be looked at. And in Canada right now, there are people that are looking at what might we have done better in terms of our public health initiatives at the beginning, as far as the pandemic was concerned, with vaccines and so forth. I know there were countries where they locked people up, basically, you know, locked down communities, you know, very coercively for long periods of time. And, you know, they perhaps had lower numbers of deaths, but is that a justification? You know, when you take so many freedoms away that people are basically prisoners. You know, we had you know, isolation mandates for brief periods of time when at the beginning, and people found those very hard to deal with. You know, I think people were more willing then to wear masks initially because at least they didn't have to stay in their house for, and not go out. So again, these are, those are very, very good questions. And that's where we need to do the research to figure out what's the appropriate way to go. I'm not a public health expert in that. I deal with the ethics around it, and so I couldn't say that we should have done this or we should have done that. But there is research right now that hopefully will inform how we're going to approach things if and when the next pandemic comes.
Okay, thank you. Since there was such a difference between like countries in the way they handled situations like the pandemic, would you say like are there any ongoing like international efforts like standardize the concept of ethics in healthcare and stuff like that?
Well, there's there's always discussions for sure among ethicists. I don't know that, and of course the World Health Organization tries to make recommendations for global kinds of recommendations. But again, it's really in terms of informed consent at the macro level. It's really up to individual governments to decide whether or not they're going to abide by World Health Organization kinds of directives and so forth. So there is work going on all the time, and outside of public health, even in the ethics area, there's lots of discussions going on continually among in bioethics, whether or not there are universal values that should apply, globally to everyone. And some people say, well, no, it's up to each individual country or each individual culture to set their own values and so forth. Well, when you're dealing with a public health thing that could effectively, a pandemic that could effectively wipe out the human race, then I suppose we can't sort of say, well, it's up to each individual country to choose. We may have to have a global mandate, but again, it'd be very hard to enforce that, wouldn't it? Individual countries we can try to persuade and use those other kinds of measures to get other countries to toe the line. One of the big, of course, equity issues in public health around vaccines and so forth is that often the developing world just gets left behind, and those of us in the rich world, we've got more vaccines than we need and so forth. So that's I should tell. I've only got a couple of more minutes myself here. Then I'm going to have to leave, so I can maybe take one or two more questions.
Sounds perfect. There's 2 questions in the chat right now. One is, how can I get informed consent in an experiment that requires the participants not to know the details of the experiment?
Well, that happens very much in social science research on a regular basis. That if you want to do observational things where you're just observing how people behave, and it would confound your results if people actually knew you were being watched, then it may. What you'd have to do is prepare a proposal and take it to a research ethics board, and they would tell you whether or not it was okay for you to go and do your observations without getting the consent of individuals. That's again, we in clinical trial work, when we're like doing drug testing and so forth, we often have a placebo arm where people don't know whether or not they're getting the drug or not, but they're informed ahead of time that they could be in the placebo arm. And in some social science research, for example, when you're doing observational things, one of the if you're not getting informed consent, sometimes if you were say you were going to a local mall because you were going to observe how people behaved, in a particular area. Well, a research ethics board might require you to, even though you're not going to tell which individuals are being observed, you may have to post it on a website, or have signs up in the area that says, there is research going on and you may be observed right now, in the same way as we often have, if there's a video surveillance and so forth, you're told that there are video cameras here, just be aware that you're being observed. They're, again, depending on the research and the kind of question you're asking and how invasive your observations might be to individuals, a research ethics board may or may not approve you doing your research without getting consent of the individuals. But those are some of the considerations that would go in. I can't be more specific without knowing exactly the research that was being proposed.
Okay, thank you. I guess that's all for the questions in the chat. So
do you have your own question? You want
I have
to? You have the privilege, so just I would save the last question for Ariana.
Okay, yeah, I can just ask one more question. So how would you say that the concept of like informed consent has like evolved in public health like research over time? Like, has it changed? And are there any like emerging like trends or challenges that come with it?
Well, as I said, the informed consent often doesn't play a big role in public health because of the in the traditional sense of informed consent, where we actually get people to sign a consent form, because it would be in many of the public health research initiatives are looking at literally, because we want to get information about the public, we have to look at thousands and thousands of cases. We have to collect all kinds of data from, it would be impractical for us to actually get informed consent. However, there have been, of course, infamous examples of like the Tuskegee research project that took place in the States, where people were enrolled into research. It wasn't exactly public health research, but it was on a infectious disease that had public health implications. And yes, there have definitely been changes in that respect because of these. And we had the same kind of thing here happening in Canada with some nutritional experimentation that was taking place with Indigenous children in the residential schools and so forth back in the 40s and 50s. And there was a so-called justification for not telling these people that they were in research because at the end it was going to be better for everyone. So definitely, yes, there has been a change in that respect. That if you're going to enroll people into studies that are going to put them at risk, but so there would be informed consent required, that you'd have to be informing people that they're involved in these kinds of things and so forth. But generally, when we're doing just collecting large anonymized or de-identified data sets, informed consent isn't an issue. But ever since the post Second World War, with the Nuremberg trials and so forth, after the Nazi experiments and so forth, the whole idea of informed consent in research in general has been much more central. But again, in the public health area, not nearly as central as it is in other areas of research. All right.
Good. Yes, thank you so much and it is truly for me, and I hope for everyone, it is a very illuminating journey, this seminar. And I would like to, from the bottom of my heart, to thank you for a wonderful thing that you have sharing, your wisdom, your experience, your thoughts. And also, I have noticed there we have so many good questions in our chat box, and I think all the engagement, I think it is the lifeblood of this seminars. And also we would like to recognize all the tireless organizers, volunteers for this, especially for the people behind the scene, make it nice happen. And the last appreciations for all the participants. And we do hope that you have learned from this, and maybe in the future in your academic way or become a policymaker, you take this important thing in any kind of the policy that we probably have to apply in our life, and to make our community even better, stronger, fair, efficient, whatever it can be. But there is one more thing, just one more thing I would like to can anyone give me a share screen thing? I can share the next event. So we do have a next seminar in the Saturday. It is August 19th, and the time is 7:30 Eastern time. And we have another guest speaker. He was an international student, but now he is epidemiologist at the Minister of the Health in Canada. So there's another kind of the personal inspiration story he would like to share with all of us. So if anyone are interested, please feel free to check it out in our website, in our WeChat account, and we will get more details how to participate in there. And thank you, everyone. We hope that you have gained a lot, and continue carrying forward the spirit of inquiry and collaborations in the future. Thank you so much.
Thank you.
Thank you very much.
曹老师，
你可以 share 现在，
看到了吗 ？Everyone
看到了
Okay, so this is the posters, and we're going to circulate in our circles, and but do please follow us. Okay, I think that is all for today.
Okay, 我会 stop recording now.
Yeah, please.